Hello, I'm Paul Haver, and I'm here as promised by Dawn last week to give you information on prosperity in primary care by doing the right thing. 7 years ago, now I'm not going to recite the Gettysburg Address, but many of our Medicare patients were born more or less 7 years ago. It is our duty and our honor to care for these people who are our elderlies and who have contributed so much to our culture and our country. I'm going to talk about how primary care doctors can thrive and continue to care for our Medicare patients and prosper at the same time. I'm Dr. Paul Haver, a family physician in Athens. I've been serving Georgians for the last 25 years. As the cost of healthcare has increased, big businesses, for-profit as well as not-for-profit, like hospitals, insurance companies, and financial institutions have taken an interest in profiting from healthcare. Ultimately, doctors gave up control of healthcare, and what are the results? Healthcare costs have soared, waste and fraud are massive problems. I started my practice 25 years ago, and a lot has changed in that time. Many physicians now realize that they have lost their autonomy, lost much of their revenue, lost their independent practices and decision-making, and lost their ideals. The medical profession is at risk of no longer being the calling that it had been. Doctors, it is time for us to regain control of the health care of our patients. M-Force will attempt to stop current trends by bringing physicians back to independent practice. M-Force is dedicated to helping doctors to put their hearts back into their practice of medicine, to care for our patients the way we dreamed of as medical students, and to care for our patients 24/7 with coordinated care. Today, Medicare has created exciting programs to incentivize doctors to take care of their Medicare patients with high-quality, cost-effective ways and to preserve the doctor-patient relationship. Can you believe that Medicare has almost become gold? I will show you how to transform your practice to increase your practice revenues by at least 20% in 2015. What you need to do is 1. Develop and train a team of medical assistants who can help you do annual wellness visits, transition care management visits, and chronic care management, as well as preventative care. Locate and contact all of your Medicare patients, whether fee-for-service or Advantage. 3. Check eligibility for preventative care visits using the website Cahaba-Insight. 4. Schedule annual wellness visits on all Medicare patients every year. 5. Screen and do preventative med services such as recommended by the United States Preventative Task Force. 6. Follow up with all patients admitted to the hospital or seen in the emergency room and schedule an appointment for a TCM visit. 7. Do transition care management visits to reduce hospital readmissions. The hospitals will thank you and Medicare will reward you handsomely. 8. On Medicare patients with 2 or more chronic medical problems, do chronic care management. 9. Check quarterly on your progress using reports from your ACO or through your EMR. Let's calculate and estimate what can happen if you have 1,000 Medicare patients. A practice with 1,000 Medicare patients. 1. Annual wellness visits pay an average, say, of $150 each. So $150 times 1,000 patients equals $150,000. 2. TCM visits are follow-up from hospital or emergency room visits. Estimate 10% of admissions. That would be 100 patients times $200 average TCM payment, which equals $20,000 a year. 3. CCM visits for patients with 2 chronic medical problems. Estimate 75% of your Medicare patients. That would be 75% of 1,000 patients. That's 750 patients times 12 months times $42.60, which is paid for the CCM work, That equals $383,400. The annual physical exam, EM codes, and visits 4 times a year per patient are in addition to the annual wellness visits and the other things we've talked about. That's an average of $100 per visit. So with 1,000 Medicare patients, that would be 4,000 visits per year, and that comes to $400,000 a year. 5. Preventative care is estimated at about $200 per patient per year. So for 1,000 patients, that equals $200,000. The total is $1,150,400 per year per 1,000 Medicare patients. This is an estimate. Now, go to your practice and please spend time with your billing manager and see if what I'm telling you makes sense. If not, please contact Enforce to help you. You may use the comments section here on YouTube below this video, or you can use the contact information located at the end of the video and listed in the description below. What happens if we don't regain control of healthcare? Well, businesses will perform annual wellness visits and chronic care management, and such as Walmart, Walgreens, Kroger, they will happily collect the money that you leave on the table. You'll find your patients are being seen by freestanding businesses with hired healthcare providers with no interest in your patient's long-term outcomes. Enforce wants you to regain your position in the healthcare arena, remain independent, and work for yourself. Join an ACO. The benefits of joining an ACO are: 1. Joining an ACO will improve the functioning and profitability of your practice while increasing patient well-being and satisfaction. 2. Providers get a chance to make more money without financial risk. 3. Patients get care that is focused and keeping them out of the hospital and off the operating table. 4. Medicare patients are free to see other doctors outside the ACO. There are no patient restrictions. Enforce will help you to transform your practice to prosper and remain independent. Join us as we return healthcare to its roots, to healthcare managed by you, the doctor, rather than the insurance company, hospital, or government agency. Please subscribe to Enforce channel so that you will not miss another video to improve your practice. The next video will show you how to do annual wellness visits in your practice. May the Force be with you. Now, go to your practice and please spend time with your